Good afternoon, everybody. Good afternoon, everybody.
Good afternoon, Miss.
I did not realize that you are in waiting room. I was just talking. After a while, only I realized that you are all in waiting room. Okay, can you all mute yourself? Okay, so we will see, like last class, we have seen how to lift a patient or how to transfer a person from one place to another. Now we will see how to lift an object. Okay, so even here also we have one person and two person lifting. So we will see that, and later after that we will I will show you some of the videos of transferring a patient. So usually transferring a patient as well as you will be getting ask key question from both. Is that clear? Okay. So uh, so in this class we will be seeing what is the proper lifting process of an object, and not only that, what is the proper unloading. That is, it is not only lifting, you need to keep it safe. So what is the correct posture and what are the incorrect postures? So, and what are the postures we need to avoid it. Okay, so first thing, so lifting is not a single thing, it is a process. So you need to plan for the process. So before lifting, you need to plan, you need to check the pathway whether it is clear. For example, if you are lifting a heavy object and you want to move out of the room, you need to first check whether you have opened the door or not. So without opening the door, if you have just lifted the object and going near the door, nobody will be there to open the door, isn't it? So before lifting, you need to plan for your lifting process. So in that, main thing is how you are going to lift from which place to which place, and whether throughout the pathway whether everything is clear or you have any hurdles, you have any sharp objects, you have any tables, or you have any edges that is going to poke you. So all those things you have to check. So if any hazardous things are there, then you are supposed to remove that first before lifting the object. Then, like whether you will be able to lift the object alone, or you need any assistant, or you need any equipment to lift it. So whether it is too heavy, or like you need some equipment, bigger equipment, or any person. So that also you have to assess. So before lifting, these are the two things: one about the pathway, another one about the heaviness of the object. Then, when you are lifting, you need to see whether you are doing it correctly. You need to position your body, whether your body is correct to lift the particular object. You should not twist your back, twist your spine. If you twist your spine, definitely you are going to affect your spine. Okay, so how you are going to lift it in a correct manner, then how you are going to unload it. That is during the lifting process. Then when it is very heavy, you have to try to get help. That's what I said early. So don't think that it is heroism to lift alone. It is not like that. So you have to see whether you have any assistance, and if not, you just wait for the assistant. Communicate properly with the partner so that both of you have the same understanding. Don't think that he will, don't think everything in your mind and think that he will understand everything, or he will be able to understand, or since he is a physiotherapist, it doesn't mean that both of you will have the same thoughts. So everything you need to communicate with the other person. That is very, very important. Okay, so this is your lifting process. So lifting process is, lifting is a process, so it has like you have to plan before lifting, and while lifting you need to do something. Then after unloading also you need to do something. So this is a process. Okay. So whenever it is heavy, try to utilize some equipment. So that equipments can be a simple forklift. So this is a forklift. Can you see? It's a forklift. You have to just tie the heavy object and you can lift using that. So this is a forklift. Then you can turn this handle and you can place in some other place, or you can just push this and you can take it to some other place. Then you have something called host, you have something called dollies. So this is like your powered higher end lifters. This is a forklift. So it will be attached with the power cart. So whenever you want to move, you can move it. You could have seen all these things in Tesco, especially in the bigger Tesco. If you see, there will be some orange color kind of equipment that will be just moving around. So it will be having the forklift along it, and the person will be able to attach to the forklift, and he will be able to move like a car to wherever needed. Okay, so this is a forklift. So this is a very very simple one which we all will be having at our home. We used to have this at our home. We used to use this for cylinder lifting especially. Okay, so many of us will be having this. This is called as hand truck. Okay, so this will be helping you to lift a smaller object with a manual thing. It doesn't have any electronical powered thing. It's like a manual thing. So this is a bigger one, like which will be helping you to lift bigger objects like unloading and loading ships. So if you see, like there will be big cranes that will be landed or that will be fixed along with the ship, and this will be helping them to load the ship with the container and unload the ship with container. You can see when you are going towards Penang through the ferry. If you see, like you can see lot of cranes like this. It will be fixed along the harbors. So these are the bigger equipment which will be helping you to lift very big containers and very big objects. So not only that, you have something called conviners. So this is this will be there in lot of shops, factories, which needs to carry lot of cardboard boxes like that. So you can also see this containers in flight airports. You can also see this. It's same like our this one elevators. Okay, so you can see in malls, so it will be having with steps, but here it is flat. So you can use, like if you want to use from one floor to another, then it will be like a staircase. Okay, but if it is if it is need to be taken to a same floor, then they will be making it as a flat and it will be carrying the luggages. So these are some of the equipments. So we have a simple hand truck equipment to a bigger cranes and bigger hoist or containers or many things. So according to the weight of the object, you need to decide which one you want to use it. Okay. So how to do a lifting? First thing is plan. As we know, we need to see what is the weight of the object, shape of the object, and size of the object. Because like weight of the object, if it is too heavy, then you need to call for a attender or a helper. If it is like a smaller one, then like shape, whether it is regular shape or irregular shape, and size, whether you are able to something, maybe the object may be lightweight, it will be very less weight, but it is very bigger than yourself, then it will be difficult for you to lift and move in a pathway. Okay, so that's why you need to see what is the weight of the object, what is the shape of the object, and size of the object. Shape of the object, if it is a regular shape, and then the lifting technique is different. When it is an irregular shape, the lifting technique is different. Okay, then this is the first thing. Then second is as we have known early, clear the pathway. Make sure the objects, the doorways, the corners, everything is clear. Everything is open. Okay. Then unload the where to unload. So that is your plan. Then next, how to lift the object. So first thing is, this is how to lift a regular shape object. Regular means a rectangular shape or a square shaped object. So first thing, you stand near to the object in a wider stance. So can you see here, in a wider stance? So you have to make sure that he is standing near the object and he has to stand in a wider stance. Why wider stance? Then only the base of support will be bigger. So the person will be able to lift the object properly and move. Then bend the knees. So do not bend your trunk. Do not bend your trunk. Usually Asians will have this kind of bad lifting posture. We always bend our trunk to lift anything. So same thing, if you want to lift any babies also, we will be bending our trunk to lift the babies. So we should never bend our trunk. So can you see here, the trunk is straight. He is maintaining a straight back or straight spine. Okay. Then bend your knees alone. Don't bend your trunk. Bend your knees. So you can bend your spine at the waist level. So not like, don't make a C-shaped spine. Okay. So this is very, very important. Then pull the object close and grip it properly. Pull the object close to your body and grip it properly. Then tighten your stomach and lift your head. Tighten your stomach and lift your, sorry, actually it should be lift the object. Okay, so it is not head, it is lift the object. So tighten your stomach and lift the object. Why you want to tighten the stomach and lift the object? That will be helping you to uh, hold the pelvis or maintain the core stability muscle in a normal stabilized manner. Okay, so that's why you need to tighten your stomach and lift the object closer to your body. Then just raise your leg. When you are raising or when you are straightening your leg, automatically you will be able to lift the object to your chest level. So he is not lifting. Can you make out? He is not. He is just bringing the object closer to the body. Okay, then he will extend the knees. Once he is extending the knees, automatically the lift will be, the object will be closer to his trunk. Okay, so this is the right way to lift a regular shaped object. Now, how to lift a irregular shaped object? So this is a method to shift the irregular shaped object. One thing is, like, you need to squat near the bag or any irregular object. Okay, squat near, that is like bend your knees and squat near the irregular shaped object. Then grab it at the opposite corners. So opposite corners you have to grab it. Bring it closer to the thigh or the waist level. Okay, so bring it closer to the thigh or the waist level. Then just stand up. So once you stand up, automatically the weight will be near the stomach or near the trunk. Then put the load on your shoulder and you can walk. Okay, so this is the correct method to lift the object. This is the lifting a irregular shaped object. The previous one was lifting a regular shaped object. Why you want to put this on the shoulder? Because irregular shape means it will be keep on dragging you here and there. So when you are walking, the weight will be dragging you here and there. You will not be able to walk properly. That's why they are asking you to put the weight on your shoulder. Is that clear? Okay. So now, how to do a team lifting? So this is two-person lifting. So far we saw single person lifting. So this is two-person lifting. So as I said earlier, you need to designate who is going to lead the lifting. That is, who is going to be the leader. Okay, decide that first, and the leader will be giving you the instruction. So at the count of three, you have to lift. Then saying this, after saying this, then they will be counting three. Is that clear? So first, whenever you are designing about the team lifting, First, you designate who will be the leader. So after deciding who will be the leader, then the leader have to give the instruction to the other person. So once the leader is giving instruction to other person, then he is supposed to lift at the same time. So for lifting at the same time only, you are going to talk something like that. At the count of three, you need to lift. So count 1, 2, 3, lift. So when the leader says lift, the person have to lift at the same time. Okay, then after lifting at the same time, keep the load at the same level. Okay, so one person should not keep it on the shoulder, other person should not keep it on the hand. If the load is not at the equal level, then the shorter person will be having feeling more heavier. Is that clear? So try to keep the load at the same level. So if you are not able to keep at the same level, then the shorter person will be feeling a heavier load. This you would have felt whenever you are lifting some heavy object through staircase. So the person who is walking in the front will not have much load, but the person who is walking behind will be having much load. This is because the load has to be at the equal level. Okay, then slowly, then after lifting it, walk to the area wherever you want to unload. Then slowly unload. Make sure your fingers are not getting caught. Make sure your fingers are not getting caught while keeping the load down. So when you are keeping the load down also, both of the person need to keep the load at the same time. If they are not keeping the load at the same time, then they will have the problem. Is that clear? So slowly unload together at the same time. Is that clear? Next. So how to carry? So far we see like how to lift the object. Now how to carry the object properly. So carrying, you need to make sure that you are able to see the pathway clearly. That's why I said early, even if the weight is very, very less, but the object is bigger than your size, when you lift it, you will not be able to see the pathway. So make sure you get an assistant for that also. So when you are carrying the load and walking in the pathway, you are supposed to see the pathway clearly. That means the object should not hide your face. The object should be lower than your face. Then take small step and take stable step. So take small and take stable steps. Do not take like longer step. Okay, make sure you are able to see the object. Make sure you are able to take small steps and you are able to take a stable steps, which is very, very important. Next, do not twist your body at any time. When you are twisting the body, you are affecting your spine. The spine, whenever it is getting overloaded, the I think you would have known, like you would have read in your physiology, that you will be having a disc in between the spine, both the spine bones. So the disc will be compressed and the water will be coming out of the disc. So when you twist, what happens? This water will be spilling out and then you will be damaging the disc as well as you will be damaging the bones. So later on you will end up in intravertebral disc prolapse. Okay, so that's why do not twist your back whenever you are taking the load. Sorry. Okay, next. So this is the method to carry the load properly. So three things, like you are supposed to see the pathway clearly, take small steps, take stable steps, do not twist your back. Then how to unload the weight. So when you are lowering the weight, you are supposed again bend your knees to let the leg muscles support the weight. Okay, bend your knees. Lower the weight slowly. Do not drop it. When you drop it, you will be hurting your upper limb. So when you are lowering it, lower it slowly and keep it down. Do not drop it. Avoid sudden movements. Okay, so avoid sudden twisting and turning movements. Lower the load at the same time. This is very, very important in case if you are having a partner. and be careful with your fingers in case if it is getting hurt under the load, then you will be hurt. You will be injuring your finger, so you need to be very careful on it. Okay, so this is your lowering weight. So far we have seen how to plan for lifting. 1 minute. Okay, so far you have seen how to plan for lifting, how to lift the object, how to carry the object, and how to load the object. So in lifting, you have a plan for lifting a regular shape object and lifting a irregular shape object. Okay, and lifting two-person lifting. Okay, so next we will see how to handle overhead loads. So how to lift an object above your shoulder level. So it is not same like your normal thing because you will be able to see the object clearly. But once the weight is over the head, then you will not be able to see the object. So that's why you need to have a different plan for it. So here stand facing the load. So in case, so you can see if this is the box he is going to lift, then he is supposed to see the load and stand facing the load. Then slide the load closer to the body. Slide the load closer to the body. Then maintain a proper erect posture. This is very, very important. So nowhere the person is having a C-shaped spine. So the spine is straight. Okay, so maintain a very good posture in a like with the spine very straight. Then bring down the object. Is that clear? Then bring down the object or climb down the stairs or anything, then bring down the object. So this is to handle the overhead loads. Now how to handle a long loads. Long loads means like maybe it is very lightweight, but it is a long weight, like a load or a pillar or a stick or a wood or truck like that. Okay, so how to handle that? So pick up at one end, place the balance point on your shoulder. So as we know already, all the object will be having a center of gravity. So you need to find out what is the center of gravity of that particular wood or of that particular load, and keep that center of gravity on your shoulder. Is that clear? So in biomechanics you would have learnt about center of gravity of a baseball bat. So in the baseball bat, the center of gravity will be little towards the heavier end. So same concept only you are going to use it. So you are going to see how big is the load and may find out the midpoint of the load. Then if the load is heavier, then bring it towards the heavier side. Okay, little bit. Otherwise, if it is same, then the center point is the COG. So place the center point COG on your shoulder. Then watch the other ends. Do not, when you are lifting and turning or walking, do not hit the person behind. So some people you would have seen, they will be carrying heavy weights and they will be walking here and there. The other end of the load will be hitting many people. So watch the ends of the loads. So make sure it is not hurting any other person. So this is handling a long loads. Okay, then. Next is always think about your back. Do not think that lifting alone is a heroism. There's nothing heroism in that point. Okay. So make sure like always think little bit selfish that whether it is going to hurt your back. So when it will be hurting your back means when you are not maintaining the posture, definitely it is going to hurt your back. So here if you see this particular person, he is lifting a object bigger than his body size. So he is not able to see it, so he will not be able to walk properly. Okay. So think about your back, be diligent, be little bit selfish, no problem. Think long term. That is, when you are young, if you are lifting improperly, also nothing will happen. But later on, when you are aging, that will be affecting your back. Okay, so when you whatever you do now in your 20 years or 30 years, that is going to affect you in a longer term. So that is definitely going to affect you back by 40 years or 50 years of age. So that's why think long term. Okay, so be diligent, think long term. Do not try to lift too much at the same time. Okay, consider your back in all your time. So these are the main points you need to keep in mind whenever you are lifting any object. Then these are some of the things which we should not do it. Okay, so you need to see some of the things, some of the movements we should not do it. One is when lifting above your shoulders, then you need to, sorry. So here first thing, if you see, the person is bending the spine. So this is the awkward lifting posture. Okay. In the second thing, if you see, can you make out the person has twisted his body. Okay. Then you can see here clearly he has twisted the body and he is unloading the weight. So this is the awkward lift. So you need to see whenever you are lifting any object, the object should be closer to your chest level. So bring the object closer to your trunk level. Do not lift above the shoulder. Do not lift below the knee length. Do not lift at the arm distance. Okay, so do not keep your hand stretched and do not keep it at the arm length distance. So these are the awkward lifting, and bending your trunk, twisting your back is also a awkward lifting. So from the below list, can you tell me what are the activities that will be causing you a back injury? Anybody can just unmute and tell me what are the position that will be causing you back injury.
Twisting of your spine.
Okay, twisting of your spine, then
using poor lifting techniques.
okay. Any other in this?
Bad posture,
Bad posture. Okay.
bending,
Okay, bending. So if you see in the from the list, all these postures are going to affect your back. So reaching down. Okay, so reaching down with your spine in a C shape definitely is going to affect your back. Then bending down, sitting for a long time also is going to affect your back. So you would have experienced this like throughout. If you have continuous online classes, at the end of the day your back will start to ache. So all these postures are going to affect your back. Okay, so you need to take care about all these activities. Then what are some of the other activities that will be, sorry, the previous slide, it is shown with the pictures. Okay, so this is your reaching overhead. Okay, so the posture is abnormal. Then bending down to tie your shoelace. Sitting in a slouch position for a long time. Poor lifting technique. Okay, so what? Okay, so these are these are some of the other things. Other things like I think twisting, bending, you all know how it will be. Isn't it? So let me show you some of the pictures. You tell me what is wrong with that. Okay, so first picture. Okay, sorry. The answer is also coming along with the picture. Okay, so first thing, like what is wrong with this particular person? So first thing is the box is little longer. That is, it is taller than the particular person. Okay, then he is moving this heavy box alone. He is supposed to call somebody, so because the object is bigger than his size. Then he tilts the box towards his body. So when you are tilting the box towards the body, what will happen is the box, sometimes if the box slips, it will be falling on you. Okay, so when it is falling on you, you will be hurting your back or you will be hurting your head. So this is again a wrong thing. You should not tilt the box towards your body. Then he tries to rotate the box on the edge and tries to move it. Okay, so we will be, sometimes we will be rotating with the edges and we will be trying to move the long object, isn't it? Same thing he is also trying to do, like how we will be rotating the cylinders and we will be moving the cylinders. So same thing this person is also doing. Okay, so rotating the box on the bottom edge and he is moving it. Then when the box is falling down, he tries to grab it. Okay, so when you are grabbing it at this position, you can see the back is completely twisted and bent. So when you grab the object in this particular position, it is straight away going to affect the spine. Is that clear? So these are the mistakes you need to avoid to prevent the back injury. So first thing is, whenever the object is heavier, you need to look for any assistance. Then when you are tilting the box, you should not tilt it along with your body or towards your body. Sometimes if it falls, it will be falling on you. Then when you are rotating the object on the bottom edge and if it is falling down, do not grab the box. You have to leave it. If you try to grab, then you will be straining your back. Okay. So you need to think of all these questions before. These are the questions that should be asked before planning the lifting. So whether the box is too heavy, whether the box is too big or too tall to move alone, whether proper body lifting technique can be followed in case if we are lifting the object. Then whether was the back belt a factor? Okay, sometimes you need to wear the belt. Most of the people who are working in this weightlifting area, they will be wearing the belt, lumbar cycler belt. So this belt will be a supportive factor. Okay, so supportive to prevent injury. So all these questions you are supposed to ask by yourself, and if you get a good answer, that is like if you get an answer that it is not going to affect you, then only you need to try to lift the object. Okay, so these are the another things you need to keep in your mind. Do you understand the safe lifting technique? Do you understand the carrying, unloading, and overhead long and loads are like how to lift all these loads? So these are the things that will be helping you to avoid or prevent injury. Is that clear? So first thing is maintain proper posture. Then exercise regularly to maintain the good fitness of your core stabilizing muscle. Use always lifting equipment and have a lifting plan. Use your leg, bend them while you are lifting. Always think about your back. So these are the important points that you have to keep in mind. Is that clear? Okay, so this is about lifting the object. Okay, so any doubt so far?
No, miss.
Okay.
So in OSCE, how the questions will be means the patient is coming to you with low back pain. Okay, so teach. Okay, the person is coming to you with low back pain. Then teach the person how to lift the weight properly, or else like it can be also like this. person is working as a caregiver in a home. So the person is treating, or the person will be taking care of old age people who needs to be lifted many times. Okay. So how you will teach the person how to lift any old age person or any neurologically affected person. So you need to teach the caregiver how to do lifting. Like you can teach single person lifting, two-person lifting to the person. Then at last you try to teach him what are the good postures to do it. Okay, so or what are the things he has to keep in mind while he is lifting any object or something. So it will be a combined question of both the chapters. Is that clear? So to both the things you need to teach the person. Is that clear? So now the time is 3:15. I'll give you some 5 minutes break. Then after that we will see the videos of last class. Is that clear?
Okay. Yes, miss.
Bad. So we'll start. So first we will see about the single person lifting. So how to lift a patient uh, without any assistance. Okay. So you can see this video.
Yes,
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm okay. How are you?
Good. I need to get you out of bed and into a wheelchair. Is that okay?
Yes.
I'm going to pull your curtain for privacy. Let me go wash my hands, get my supplies, and I'll be right back.
Okay.
So, how are you feeling today?
I'm okay.
Are you dizzy at all? Or
No.
weak?
So this is a belt, transfer belt or gate belt or trochanteric belt.
Okay. Can we get everything set up here? I'm going to pull the sheet down to the end of the bed, and that way we can get you sitting on the side, okay?
你可以说我，你知道没？其实老师讲，哎呀，不折痛，我卖讲5分钟，我打10分钟，可是别人做了。
Can you scoot towards me, please? Okay. I'm going to put one hand over your knee, one hand under your shoulders, and I'm going to pivot you so you're sitting on the side of the bed, okay?
Okay.
Can you cross your hands over your chest for me? Feel okay?
Yes.
Dizzy at all?
No.
Okay. Let me put your shoes on. Okay. I'm going to put this gate belt around your waist. This is going to help me lift you up and put you in the wheelchair, okay?
Okay.
Make sure I can fit 4 fingers in there. Is that too tight?
No.
Okay. Are you comfortable?
Yes.
I'm going to bring the wheelchair a little closer. Okay, if you can put your feet together for me. I'm going to put one foot in front to keep your legs from slipping out. On the count of 3, you're going to put your hands up here. I'm going to lift you, turn, and we're going to sit down in the chair, okay?
Okay.
Ready? 1, 2, 3. Very good. You feel okay?
Yes.
Okay. You just remove the gate belt from you. I'm going to unlock your wheelchair and turn you around so that we can position your leg on the foot pedal. There you go. Let's relock your wheelchair. Feel free to unlock the wheelchair if you'd like to move. You feel okay?
Yes.
Okay. Here's your call light if you should need anything. Now I'm going to wash my hands. I'll review the steps of my skill, make any corrections, and my skill is done.
Need scrubs for your new career? Visit 4.
Okay, so this is single person transfer. Okay, so there is one more video explaining single person. Just a minute. Okay, so this is single person transfer but using the pivot.
So I'm going to go ahead and sanitize my hands. The only supply that I need is a gait belt, and I do need the wheelchair. So I'm going to go ahead and scoot that closer to the bed. Going to make sure to lock the bed. For this skill, you definitely have to lock the bed brakes and the wheelchair brakes. Move that out of the way. And then I'm just going to put my wheelchair toward the foot of the bed for right now. Get it kind of where it needs to be. And I'm going to lock them just so I don't forget. All right, Olivia, go ahead and you don't really need to pull the curtain for this skill either. I'm going to raise the head of your bed, make it easier to get you out. All right, so go ahead and pull your feet to the side of the bed. Out just a little bit. We're going to turn to the side. And then set you up. Are you dizzy? Nope. Go ahead and put the gait belt on you. Does that feel okay? Make sure to check it, make sure it's tight enough, not too tight. And put your slippers on. So if you have somebody that's pretty tall, you might want to raise the bed a little bit so that their feet are flat on the floor. Her feet are on the floor, so that's fine. And then I want to scoot the chair close enough to her so that she doesn't take any steps when I stand her up. So what we're going to do is I'm going to put her foot closest to her, just kind of scooch it in toward the wheelchair a little bit. And then I'm going to grab underneath the gait belt. I'm going to point one foot, one of my legs, to the chair, and my other one toward her. And on the count of 3, you're going to push off from the bed and just stand, and I'm going to pivot you or turn you toward the chair. Okay? So 1, 2, 3. And then go ahead and sit. All right. I'm going to take
Okay, so if you see here, we are not supposed to make them to stand too much and put weight bearing on that. Just lift, turn and put them back on that particular position. Okay.
the gate belt off. Can you scoot back in the chair a little bit? All right. Are you comfortable sitting here? So you can either leave the brakes on or off. It doesn't really matter because she can unlock them herself. And I'm going to give her her call light and water. Can I get you anything else? Okay. Go ahead and sanitize.
Next is like how to shift them using a slide board. Can you see the video? Can you see the new video?
Yes, miss.
Someone who needs a little bit more assistance, get as close as I can. Okay, I'm gonna take footrest off closer. Okay, tops off. Okay, I'm gonna get a little bit closer here. And then I'm gonna put the brakes on. Okay, take the other footrest off. Okay, I'm gonna have gloves on because gloves are always easier and cleaner when you're gonna be in the bathroom with someone. And you can buy the boxes really cheap at Sam's or Walmart or somewhere. I'm gonna put the gate belt. So I'm gonna put the gate belt under them. And you wanna put it below the rib cage and as snug as you can. It gives you really good control. Okay, we're gonna use, not able to stand very good. We're gonna scoot over. So this wheelchair has swing back arms. So some armrests come off. This one happens to swing back and out of the way. And then this has a drop arm where it just kind of drops out of the way. So you're able to do a smooth transfer without having to stand. I'm still going to scoot them out to the edge because the feet need to be close. And we're going to use a sliding board. So this is a sliding board. They come in different lengths and different materials. They can be plastic or wood. And you're going to just tuck it under the hip. Make sure not too far back under the butt. You want to get closer to the hip so they don't scoot off of them. Okay? You can have them put their hand there and then push off here, but I'm still controlling them with my knee. So we're just going to scoot. They can either hold here, and I'm still blocking their knee, and I'm transferring them. And then I'm going to put this here, and then just scoot them back. Okay? If they lean that way, I'm just going to chew this out of the way. And I leave the wheelchair here, and usually I kind of keep the wheelchair there for safety, and I can pull this up. So once they're there, we can work on shimmying the clothes off. So I can shimmy and go part this way, and then back this way, and just really, if they don't have good trunk control, I may lean them forward, but I'm controlling them with my knees, and that's how I kind of work on getting that off. Okay?
Okay, one more sliding technique.
Now I will show you how to properly transfer a patient using a slide board. This transfer can be used if the patient is not strong enough to stand, requires the use of a slide board due to paralysis, or is non-weight bearing due to a recent surgery or injury. Ask the patient how he or she usually transfers with the slide board. They will hopefully be able to tell you what works best for them. For your safety and the safety of the patient, always use a gait belt. The belt should be placed low around the patient's stomach at about the height of the belly button. Be careful to watch or ask the patient about any recent abdominal surgeries or colostomy bags. In those cases, you may have to place the belt higher or lower to avoid incisions or devices. Make sure the brakes of the wheelchair are locked and the leg rests have been swung out of the way or removed to avoid any possible skin tears or tripping hazards. Also remove the armrest from the wheelchair. Make sure the chair is at about a 45-degree angle to whatever surface you are transferring to. Have the patient lean to the side, away from the table you are transferring to, instructing the patient to lift the leg closest to the table. Slide the sliding board underneath the leg, ensuring that it is firmly placed underneath the patient. Have the patient redistribute their weight so that one leg is on the sliding board and one is on the chair. Explain to the patient exactly what you plan to do and what you need from them. It is important that you instruct the patient not to place their fingers underneath the sliding board, as this would cause them to pinch their fingers. Stand in front of the patient with a hand on either side of the gait belt. Squat to use your legs to help the patient slide across the board. Do not twist your back. On the count of 3, help slide the patient slightly onto the board. At the next count of 3, slide again until the patient is safely on the table. Have the patient lean again to remove the board from underneath their bottom. Make sure the patient is safely on the table and remove the gait belt.
Okay, so next is how to shift a person from wheelchair to car.
Hello. To a car. Today's presentation is designed to help you correctly perform a wheelchair to car transfer and correctly transfer the person back from the car to a wheelchair. We will start by explaining how to correctly perform a wheelchair to car transfer. Step 1. Position the care recipient behind the passenger door alongside the car. Inform them about the transfer and what you are going to do. Ask them to help you if they are able to. As you transfer the care recipient, continue to talk them through the entire process. Step 2. Be sure to lock the wheelchair brakes before moving forward. Step 3. Assist the care recipient in removing their legs from the footrest. Step 4. Swing the footrest assembly out and away from the care recipient's legs and lift to detach. Set the footrest assembly off to the side so it will not become a tripping hazard. Step 5. Let the care recipient know that you are going to start the transfer. Place your legs apart with the care recipient's legs together in between yours. Get as close to them as possible to avoid arching your back. Place your arms underneath the care recipient's armpits and lay your hands flat against their back. Be sure that your knees are bent and that your back is straight to avoid injury. Lift using both your legs and use your arms to bring the care recipient to a standing position. Step 6. Take small steps backward, keeping your arms and hands in the same position until you are positioned against the door and the care recipient is standing beside the seat. If the care recipient chooses to hold onto the car for extra support, be sure to use the side of the car and not the door for support. Step 7. Turn the care recipient until their back is facing the passenger seat. Then begin to reposition your arms and hands. Your left arm should be underneath the care recipient's right armpit, and your hand should be lying flat as close to their left shoulder as possible. Your right hand should be positioned on the back of the care recipient's head to prevent contact with the roof. Slowly lower them into the seat and bend your knees as you go. Remember to keep your back straight. Step 8. Once the care recipient is seated, adjust your right arm positioning. Place your right arm underneath both of their legs while keeping your left arm in the same position as before. Swing the care recipient's legs into the car using your right arm while supporting their back using your left arm and hand. This is a picture of how your left arm and hand should be placed when you are pivoting the person's back and feet into the passenger seat area. Step 9. Once the care recipient is comfortable, be sure that their seatbelt is buckled. They may be able to perform this task, or you may need to assist them. Once their seatbelt is fastened, make sure that the care recipient's hands, arms, and legs are inside the car and close the door. After you fold the wheelchair and place it in the trunk along with the footrest, you're ready to go. Now we will show you how to transfer from the car to the wheelchair. Step 1. First, unfold the wheelchair and position it behind the passenger door and alongside the car. Next, lock the brakes to ensure that the wheelchair does not move while transferring. Step 2. Open the door and ask the care recipient to remove their seatbelt or assist them in doing so. Be sure to inform the person about the transfer, including the steps and what they can do to help you. Step 3. First, position your left arm underneath the care recipient's right armpit and then lay your hand flat on the far side of their back. Next, position your right arm underneath the care recipient's legs. Step 4. Swing the care recipient's legs out of the car, being sure to support their back with your left arm and hand. Try to keep their back straight as much as possible to make sure he or she is comfortable. Step 5. Move your left arm underneath the care recipient's right armpit with the left hand flat on their back. Then position your right hand on the back of the care recipient's head to prevent contact with the roof. Be sure to keep your knees bent and your back straight as you are lifting. Remember to lift with your legs. Step 6. Once you are both standing, reposition your right arm so it's underneath the care recipient's left armpit and have your right hand lying flat on their back. You can keep your left arm in the same position. Take tiny steps back towards the wheelchair until the back of the care recipient's legs touch the edge of the seat. Step 7. Slowly lower the care recipient into the wheelchair. Your knees should be bent and your back should be straight. The care recipient's legs should be positioned in between yours as you lower them into the chair. Step 8. Reattach the footrest assemblies to the wheelchair. Step 9. Lower the footrest and assist the care recipient in placing their feet on the footrest. Step 10. At this point, it is safe to unlock the brakes. Now you are ready to go. Following these steps and knowing how to properly transfer a care recipient is always important. Proper care and accident prevention are essential so that the care recipient can continue to live a healthy life. For more information or other resources from Cato, please visit our website at www.cato.org.
Hi guys, I'm Justin with AirFit Rehab, and today we're going to be talking about transferring your loved one, a caregiver transferring a patient, or just really picking something up. I mean, this really boils down to just being having good body mechanics when you're lifting something. So today we're going to be talking specifically about the importance of preparing yourself to transfer somebody, and then safely and effectively transferring somebody. We're going to be transferring onto the mat table, then back over. But we're talking really about a dependent transfer. So this is somebody that needs a maximum amount of assistance to be able to transfer from one surface to another. And we're going to be more importantly talking about how you can effectively transfer somebody without hurting your spine. So there's really 3 different things that we want to avoid when you're transferring somebody, and that is we don't want to herniate a disc, or we don't want a disc to be bulging from lifting, and we don't want to hurt the muscles surrounding our spine when we're transferring. So there's really 4 main things that you want to watch out for when you're making this kind of transfer. And I'm going to talk about those real quick. Then I'm going to give you some even greater pointers that I've learned in the 10 years of doing this, just the things that I've picked up on from just transferring lots of different people with lots of different disabilities, and the things that I've learned to help keep myself safe so that I could be doing this, 7 hours a day and transferring people and keeping myself safe in the meantime. So So the first thing that we want to watch out for, and that everybody has heard, but people have a hard time following, is lift with your legs. So your quads and your glutes are going to be two major muscle groups that can really help you leverage yourself and lift something. Okay, so you want to avoid lifting with biceps, your shoulders. You really want to focus on the major muscle groups, the legs and the buttocks. So you should really feel those powering yourself up when you're going to transfer somebody. The second thing that you want to avoid is jeopardizing your spine. So we want to keep a nice straight spine. We don't want your spine to be flexed when we're transferring. Another thing that we want to do is we want to keep the load nice and close to you. So when I say nice and close, I mean like a lot of times what we do during these transfer trainings is I give somebody 5 pounds and I tell them to hold it out here. And I say, how long do you think you could hold 5 pounds out here? And usually it's a matter of a couple of minutes before someone would fatigue. Now I say, now bend your elbow and hold the load nice and close to you. How long do you think you could hold this? And the answer is usually, man, I could probably hold this for hours. It's 5 pounds here and it's 5 pounds here. But all you've done is created leverage for yourself. Now you've leveraged your positioning, you've leveraged the load in a way that you could support it. And that's exactly what we're going to do when we're transferring somebody. We don't want to be transferring all of their weight, and we certainly don't want to be transferring all their weight out here, because then we really talk about those compressive forces on your spine. If we're really jeopardizing the spine, not lifting with our legs, and we're taking somebody way out here and trying to scoot them over to here, it's just a matter of time before you hurt your spine. So if you follow these principles, you'll be a lot less likely to hurt your spine when you're transferring somebody. So let's get started. So the first thing that I want you guys to do is position the wheelchair in a place that it's going to be ideal to transfer. Now, when we're positioning the wheelchair, I generally like to get the wheelchair at a 45-degree angle to the place that I'm transferring. So I really want this wheelchair to be at an optimal location to where we have to do less transferring. So, all right, so I've also locked both of the brakes. And then a lot of arms on wheelchairs will go back. And the reason that we want we want to create as little bit of a problem to be able to get over here as possible. So I don't want to be lifting over top of these arms. I really want to have these arms in a location that they're out of the way, and I'm doing as little bit of lifting as possible. Okay, so I'm just clearing the mat table. I don't want to have to, pick her all the way up. I just want to clear enough to be able to get her over to the mat table. All right, so first I'm going to take the armrest off. Now this one has a button that you're going to push in, and then it'll pull straight up. Some of them fold back, some of them come straight off, and the unfortunate amount of them will not come off at all, in which case you're really having to transfer over top of it. So the next thing that we're going to be doing is I'm going to try to scoot Christy a little bit forward so that I have her in a more ideal location to where I can transfer over. So this one has really large wheels. I don't want to transfer her all the way over those wheels, so I'm going to scoot her buttocks forward so that I'm only having to clear the bottom part of this wheelchair. So what I'm going to do is I'm just going to take her legs straight up, and I'm going to scoot her forward, and now I'm going to put her legs back on the ground and lock them in between my legs so her legs can't go through the other side. So now I'm taking Christy far forward, and I like to be able to see where I'm transferring, so I have my head on her left side. That gives me the ability to see where we're going to be going. So now I'm going to get nice and close, and the first thing that I want to do is check my spine. I don't want a round spine, I want a straight spine, and I'm going to be pivoting on my right heel and my left toes. The second thing that I'm going to do is I'm going to get her really far forward. This is going to take all of her weight and put them through her feet and distribute it closer to me. So we're going to go on 3, and we're going to pivot at the feet, and I'm going to be lifting with my legs. 1, 2, 3, and then back over. Now you can actually still see my weight's still on my left toes and my right heel. Now the way that I was able to do that transfer did not put any pressure on my spine, and it kept Christy nice and safe. And that's how we want to make sure that we're transferring patients or loved ones. So the other thing is when we're going back to the wheelchair, I always make sure I have one arm secure so that we kind of have a stop point, and I want to decrease the amount of space that I have to transfer back. Another good thing is when you're transferring somebody to make sure that the feet aren't going to be in the way when we're coming over. So right now, if I were to take Christy and transfer her, you could imagine her feet trying to follow and the amount of pressure that that would take onto the knees. So another good practice is to just turn the feet a little bit before you transfer. So even that right there is going to create a nice easy way for her feet to be able to transfer or slide over. All right, so now we're going to be transferring Christy back to the wheelchair, and I'm going to go over just a few key pointers to look out for that would be different. Typically when you're transferring to something that's lower than a wheelchair, it's going to be a lot easier. But when you're going back to a wheelchair that might be higher than the surface you were just at, you really have to make sure that we're getting a little bit higher. So you're needing to do a little bit more work to get back to the wheelchair. So I'm doing the same things. I'm making sure that the wheelchair is nice and close to the mat table so that we're having to do less work to transfer over. I'm locking the brakes. Then I'm going to kind of go through the same steps. I mean, she's in a point right now where she's nice and close to the edge of the mat table. We can safely get over to this wheelchair. And I'm just going to run through all the same points. I'm keeping my back straight. I'm not using my shoulders to lift, but I'm really just securing her, then using my feet to lift, my thighs and my glutes. And then we're going to pivot over, not rotate over. So we're not rotating and extending our spine because those are the ways that we get those bulging and herniated discs, along with pulled muscles. So we really want to watch out for our posture when we're transferring back. So we're going to do the same thing. I got her knees locked in between my knees. I got a nice straight back. I'm bent at the knees, and I got her nice and close to me. And again, I'm looking at where I'm transferring to. So we're going to come far forward. I'm getting all of her weight onto her feet. I could hold this for a pretty long time. I got all of her weight right now, and it's just going straight to her feet. And then we can nice and slowly pivot over and then go back. From here, I'm holding her. I'm putting the arm down. And now we've got a nice, good transfer back to the thing. So if you guys have any questions, please shoot me an email if you have any questions. My email is justin@therafitrehab.com. Feel free to call with any questions too. And hopefully you guys have learned something. Thank you.
Okay. I think like you would have been very clear about this transfer from wheelchair to bed and bed to wheelchair. So next is we will see about 2-person transfer.
Hello, today Jessie, Danielle, and I will be demonstrating a dependent 2-person lift from the wheelchair to the bed and back to the wheelchair. This type of lift is used when the patient is unable to stand on their own, assist with the lift, or you're transferring from surfaces of varying heights. It's important to note that this type of lift is only used as a last resort when there's no type of mechanical equipment available to use, because that's the safer option for everyone involved. You'll see in a second that Jessie has taken on a leadership role. It's important for the therapist to coordinate before going in with the patient who's going to lead the lift. And since Jessie is stronger and taller, he's going to be paced behind Danielle since he'll be holding up the majority of her weight. And so he will also be dictating when to lift and also explaining everything to Danielle beforehand. You'll see that Danielle has a gait belt on, which is fairly standard for any patient every time. And you'll also notice that we try to maintain proper body mechanics throughout the entire lift.
Hi, my name's Jessie. Today we're going to demonstrate the 2-person lift from the chair onto a bed. Hi, my name's Jessie. How are you today?
Good, how are you?
Very good. I'm going to be your PT today.
Okay.
What is your name?
Danielle Fleming.
Danielle Fleming. Danielle, what is your date of birth?
8/20/91.
Very good. Do you mind if I take a look at your wristband real quick? Very good. Okay, Danielle, today, with help from Caitlin, we are going to move you from this chair onto that bed.
Okay.
So I'm going to give you some instructions. Basically, I'm just going to have you move your hands onto your abdomen when I tell you to.
Okay.
So you'll wrap them around just like that.
Okay.
What I'm going to do is I'm going to reach down through your axilla here, your armpits. I'm going to grab your wrists. And when I ask you to, I'm going to ask you to press down into my hands. Doing that will really solidify your shoulders here so that I don't cause any harm and then we have a rigid surface to pull onto. Okay? And then Caitlin will come over. We're going to straighten your arms out after removing the foot pedals for clearance there. And if this armrest had been taller than the surface that you're moving onto, you would want to just remove that. Get that out of the way. Just like that. Okay? So when once I've got a hold of your arms, Caitlin's going to come under and she's going to put one forearm underneath your thighs.
Straighten your legs.
She'll put her other forearm underneath your lower legs. And then when we're ready to go, I'm going to say ready, lift. And on lift, we're going to lift you up using proper body mechanics and put you onto the table.
Okay.
Okay? You have any questions about that?
Sounds good.
Okay. Here we go. So here's where we're going to cross your abdomen with your arms. I'm reaching through. Grab your forearms. Okay. Now press into my hands. Ready, lift. Okay. And now that I've got you positioned onto the bed, this is where I would assist you in getting a comfortable placement onto the bed so that you're comfortable. But now, since we've got you in this position, we're going to go ahead and demonstrate the two-person lift from the bed into the chair. This is basically just the same procedure in reverse. Any questions? Okay. So if you can put your arms across your abdomen, you're going to reach through your axilla and grab your forearms. Caitlin's going to put one arm under your thighs, the other arm under the lower legs. And on lift, we will lift you straight up and onto the chair. Ready?
Ready.
All right, press into my hands. Ready? Lift. And down. This is where we would reapply the foot pedals and the armrest. How was that?
Good.
All right. An alternative method to the two-person lift from the chair to the bed involves that two people, in this case myself and Caitlin, would approach the patient from each side. In this case, you want to make sure that the chair is a couple feet away from the bed. The wheels are locked. The foot pedals have been.
To perform a max assist or dependent transfer with two aids, set up the wheelchair as before. Leg rests removed, close to the mat, angled towards the mat with brakes locked. If you cannot remove the armrest, this is a good transfer to choose. The person at the shoulders will be the lead person. It is important that one person lead the transfer. The person at the patient's upper body should ask the patient to cross their arms over their chest, if they can. Then from behind, the aide will reach under the patient's shoulders and through their arms to grab onto each forearm. Be careful not to grab the patient's wrists. Hug them in so the grip feels secure. Make sure your stance is wide and that you are using your legs for the transfer, bending the knees, bracing in your abs. The aide lifting the legs should pick up the legs from the side in a cradle arm position, their body facing the mat. Bend from the legs. The aide leading the transfer should say transfer on the count of 3. The aide at the shoulder should be careful to support the patient's trunk as they remove their hands. Make sure the patient is safe.
Okay, so this is about 2% transfer. Okay, so now I think you would have remember when we were talking about transfer, I said some of the cases or some of the musculoskeletal problems will be having specific positions to maintain. So I just want to show one total hip replacement, mobility and transfer. Okay, so you can watch this.
The following are precautions for patients with a total hip replacement. When the patient is supine, Maintain the surgical hip abducted from the midline of the body and in neutral rotation. The hip should not be adducted beyond the midline of the body when the patient lies, sits, or stands. Maintain the surgical hip in neutral extension. The hip should not be extended beyond the mid position of flexion and extension. Maintain hip abduction and neutral rotation while the patient is in a sideline position on the unaffected hip by supporting the surgical lower extremity on pillows or a bolster. The surgical extremity must be in the uppermost position. Avoid external hip rotation when an anterior or anterior lateral surgical approach was used. Avoid internal hip rotation when a posterior or posterior lateral surgical approach was used. Avoid rotating or twisting the upper body with the lower extremity fixed or immobile. Avoid hip flexion beyond a range of 60 degrees. This means the patient should not sit erect in a wheelchair or in bed. Bringing the trunk closer to the thigh produces hip flexion. Avoid excessive trunk flexion while the patient is sitting. Use an elevated toilet seat and an elevated chair when available. And you just had a total hip done on your right leg?
Yes, I did.
How are you feeling today?
Oh, sore, but okay.
Okay. Well, the plan today is we're going to get out of the bed. So I'm going to help you learn how you can get yourself sitting at the edge of the bed. And then we're going to work on going into the wheelchair.
Okay.
And do you have any questions?
How much weight can I put on my leg right now?
Well, the doctor said that you can put as much weight as you can tolerate. So as, you know, how it feels for you, that's how much weight you should put on.
Okay.
And I want to make sure we review your precautions. Do you remember what your precautions are?
I think so. I can't bend it past a certain degree.
So you don't want to bring your knee up so it's past 90 degrees.
Okay.
Okay, and you don't want to cross your legs.
Okay.
And you want to make sure you keep those toes pointed straight up to the ceiling.
Okay.
All right. So now your arms are really strong, right?
Yes.
So as we're sitting up, what I'm going to do, I'm going to raise your bed up just a little bit.
Okay.
And then you're going to have your arms and you're going to be able to push yourself up into a sitting position. All right. But at the same time, we're going to be pivoting you on your bottom.
Okay.
As we're bringing your legs over the edge of the bed. Okay, so before we get up, I'm going to put what's called a gait belt on. This is just for precautions to keep you nice and safe, okay?
Okay.
So I want to make sure that, you know, if you were to lose your balance, I can help you out with it.
All right.
All right, so we won't put it on too snug. All right, now I'm going to raise your head up just a little bit. I'm going to bring that bed up just a little bit too. All right, so I'm going to guard this leg. You're going to be pushing off with your arms, or we're going to pivot you around on the count of 3. 1, 2, 3. Now I'm going to lower your leg down nice and easy. There you go. Now I'm going to get this chair just a little closer so you don't have to go so far. And here's your walker. And I'm going to stand on your weaker side here while we're standing up. I want you to push off the bed on the count of 3. 1, 2, 3, and then hang on. Good. Now we're going to take little steps around. And then back yourself into the chair. Wait till you feel the back of that chair against your leg. Now reach back to those armrests and lower yourself down. Kick that leg out just a little bit. Nice job, Linda.
Thank you.
Okay. Actually, like when you are reading about ortho neuro, you will be whenever you are reading each and every condition, you will be learning the difference in every condition. Okay. So for example, in cardio, you will be learning how to transfer a person when he is having a fracture, or when he is having a hip dislocation or knee dislocation or shoulder dislocation, like that. So in neuro, when you are learning about stroke, when you are learning about paraplegia, diplegia or hemiplegia, then they will be teaching how to transfer those kind of people. So in this particular subject, we are learning the general things about the transfer. We are not going into the condition wise. So once you learn the condition only, you will be learning all those difference. So don't think that like by this time we will be ending, but it is not like that. Like every conditions, you will again go back into the transfer. But you should know the the complete transfer, then only they will be able to teach you the other things. So before I have only two more videos, like before going to end, like I said something like in operation theaters, whenever they are shifting the patients, they will using something like rollators or gliding boards. So this is an example for that. This is a transfer board, okay? And in the sheets also you can see there is place to hold the sheet, and with that they will be able to shift the patient. You can see this is the way they will be inserting the sheet inside. Turn the patient to one side, then they will insert the sheet. Can you make out how they are inserting the sheet inside the patient? Can you see like this only they will be having boards, and they will be having sheets with handles. Okay, so the next is mobility in bed.
Here are some general considerations for transfers. Review the chart for weight-bearing precautions. How has the patient transferred previously? If possible, ask the patient or family what type of transfer works best for them. The type of transfer you use is dependent on not only the patient variables, but also on your own strength, height, etc. Allow the patient to do as much as they can. Orient the patient regarding transfers, demonstrating what you want them to do. Position the equipment and the patient close to the transfer site. Use gravity to your advantage. Transfer downhill or at least level surface. Secure the surfaces of the transfers, such as the locking bed and the wheelchair. Always use a gait belt. Position yourself and patient for the transfer. Be aware of the position of the feet. Use appropriate body mechanics. Follow the 5 cardinal signs. Keep the load close. Create an appropriate base of support. Use isometric muscle contractions of the trunk to maintain the trunk in a preferably erect position. Lift with the legs and do not twist. Where the hips go, everything else follows. Make sure the patient looks away from where their hips are going. Finally, use appropriate verbal cues. We're first going to scoot you over just a little bit before we sit you up. So we're going to get underneath your hips on the count of 3. 1, 2, 3. Okay. And then we're going to come up by your shoulder and move that over. count of 3. 1, 2, 3. There we go. I'm going to bend your knees up. We're going to bring that arm across. I'm just going to roll you onto your side. There we go. Now hook you underneath your legs here. Linda's got your shoulders. On the count of 3, we're going to sit you up. 1, 2, 3. All right, let's just let you sit there. How are you feeling?
Good, thank you.
Okay, let us know if you're feeling anything different. I'm just going to bring the chair a little bit closer here. I'm going to scoot you forward just a little bit in the bed. So I'm going to bring you this way. There we go. Okay. Okay, I'm going to get underneath your arm here. Scoot your knees up a little bit. And the count of 3. 1, 2, 3. There we go. Okay. So we're going to work more on your transfers.
Okay.
Remember yesterday we were making sure that you were just doing a log roll because of your back surgery and that you have that brace on right now. And also I brought the sliding board today so we can practice your sliding board transfer. Okay. Are we all set?
Sure.
I am going to get this belt on underneath you here. So remember what the log rolling is that you don't want to do any twisting of your trunk.
Right.
So I'm going to help you here, and I'm going to bend up both your knees. And I'll hold these here, but what I want you to do is roll to your side all in one motion.
Okay.
All right, I'm going to bring my hand here. You can bring your arm across a little bit. 1, 2, 3, and roll. Nice job. All right, I'm going to get underneath your legs, but I want you to use those arms to push yourself up.
Okay.
Count of 3. 1, 2, 3, up. Keep pushing. That's it. Nice job. Okay, well, let's take your armrest off first. I'll support here while you practice taking that off. Okay, we're going to scoot you forward just a little bit on the bed. So lean to the side here, and I'll help you with your hip. And lean there. I'm going to get a little bit closer to your chair. Nice job. All right, now, do you have yourself in the balance here? I'm going to make sure we get this board all the way underneath you. There you go. Now, make sure you don't get your fingers under here. I don't want you to get them pinched, but I want you to take your hand and push down here on the board. And we're going to do this in 3 steps. So you're going to go halfway over, one more time, reach for the chair, and pull yourself all the way over. Ready? Okay, 1, 2, and last one, all the way back. Okay, now let's pull your board out. There you go. And I'll get that armrest back in for you. All right. Okay. Good. Well, you did so well with that standing pivot transfer. Let's work on our squat pivot transfer today.
Okay.
I need to remove the armrest first. And we'll set it right up here on the chair. So instead of standing all the way up, we're going to just swing you over in a more of a squatted position.
Okay.
All right, well, let's scoot forward first in the bed. Lean this way and that way. And one more time. There you go. Again, let's stagger those feet so you got that stronger leg a little bit more forward. I'm going to protect your knee here so it'll help you when you're standing up or when you're squatting. I'm going to have you reach across over to the armrest, and you're going to look away again.
Okay.
All right, on the count of 3. 1, 2, 3, scoot right over. There you go. Nice job. Hi, Linda. My name is Cheryl Kerfeld. I'm the physical therapist here at the hospital.
Hi.
I've come to work a little bit on helping you move yourself in bed and get into your wheelchair. Are you okay with that?
Sure.
Excellent. Well, you're kind of in the middle of the bed, so let's scoot you over just a little bit first, and I'll help you out. Why don't you bend that knee up, and then I'll help you up with this leg. Okay. We're going to do a little bit of bridge, it's called, but you're going to lift up your bottom and scoot it over just a little bit on the count of 3. 1, 2, 3, and scoot. Nice job. So we're going to roll you over onto your side, and I want you to help out as much as you can with that strong side of yours, okay?
Okay.
So what I want you to do is reach over with that arm, come way across, keep rolling, good. And I'm just gonna make sure that shoulder is a little bit pulled out here so it doesn't get stuck underneath. How does that feel?
Okay.
All right. I'm gonna get your belt on here real quick before we sit you up. There we go. Okay, now you can help with that stronger leg to get your one leg down, all right?
Okay.
So hook it underneath. And I'm going to help give you a little boost under your shoulder here, but I want you to push as best you can with that arm. On the count of 3. 1, 2, 3, up you go. Nice job. I'm going to bring our chair just a little bit closer here. Okay. I'm going to get the brakes on. We want to make sure that chair doesn't roll away on us, all right? Okay, now before we get over onto the chair, we're going to scoot you forward just a little bit on the bed. Okay, so let's lean over to this side and bring that hip forward as best you can. Nice. Now we're going to lean over the other way and move that other hip. There, your feet on the floor?
Almost.
Maybe we should lower that bed just a little bit. There we go. Now, just a few instructions to get you over into your chair. Okay, now I want you to use as much of your strength as you can. I'm going to have you take this arm and you're going to reach across to that armrest on the chair. Okay? And then I'm going to have you look away because you really want to get that bottom in the chair first before the rest of your body.
All right.
And it really helps to stagger those feet. So get the one that's closer to the chair a little bit farther forward than the other one.
Okay.
All right? Are you ready for this?
Sure.
I'm going to block this knee just a little bit just so that it helps with that weakness. And I'm going to have you reach across, look away a little bit, and then on count of 3, we're going to stand up, pivot, and then sit back down. 1, 2, 3, up, pivot, now sit back down. There you go. Now we're going to scoot you a little bit back more into your chair. That's it. Nice job. Thank you.
Okay, the final video, okay, don't go, just we want to complete this particular topic.
Hi, my name's Elise. I'm going to demonstrate to you bed mobility. This technique occurs in 2 phases. First, we will move the patient from a supine position to lying on their side. Then we will move from side lying to sitting on the edge of the bed. I have Chris here who's going to help demonstrate this.
Hi everybody.
First, you want to ensure that there is enough room to roll the patient onto their side. Chris here has enough room. However, if they don't, you want to move the patient a little bit across the bed. So, in order to do this, we'll get the patient to bend up both their knees, like so, and then push through their heels and their elbows to move across the bed. Excellent, Chris. Then, if the patient isn't already positioned with their legs bent, you want to get them to bend both their legs up, like so. Excellent, Chris. If they need assistance, you can place your hand underneath the patient's foot and underneath their knee and move it up into a bent position like so. Next, you want to get the patient to look towards the direction they're going to and reach their arm across their body. And you can see he's already rolling onto his side. Great work, Chris. If the patient needs assistance to roll onto their side, you can place one hand on their hip and one on their shoulder blade and roll them on the side like so. Excellent, Chris. Once the patient's in side lie, you then move to sitting them up on the edge of the bed. First, you get the patient to move their legs off the side of the bed and then get them to push up with their bottom elbow and their top hand so that they are sitting on the edge of the bed. Well done, Chris. If the patient needs assistance, I'll demonstrate that to you now. So I'll get you back onto your side, Chris.
Excellent. So sometimes the patient only needs you just to move their shoulder forward, like so. Often they want to lie back onto their back. So you can do that by moving the shoulder forwards. The other way you can provide assistance is get your legs off the bed for me again, please, Chris. So you can place one hand on the patient's hip and one on their trunk. And then we're going to push down the hip and sit the patient up onto the edge of the bed like so. An alternative approach is using an electric bed. This is a common technique used with orthopaedic patients post-surgeries like total hip replacements and total knee replacements. Firstly, you want to sit the patient upright. Okay, then you want to move one leg at a time to the edge of the bed. So give the patient an opportunity to move their leg. Good work, Chris. If you do need to provide assistance, place one hand under the ankle and one under their knee and move the foot towards you slightly, one at a time, until they're on the edge of the bed. Okay, once the feet are on the edge of the bed, you will then need someone to assist you. I have Jess here. I'll get Jess to look after the trunk. She'll place one hand on the patient's shoulder blade and the other hand on his shoulder blade, and she'll be working on moving the patient forwards. I'll be looking after the legs. On the count of 3, Jess and I are going to move the patient in one motion so he's sitting on the edge of the bed. In an orthopaedic patient, I will also be supporting the leg to avoid, again, causing pain. So, 1, 2, 3. Great work, Chris. And we'll drop this leg down and push through your hands so your feet are on the ground. And I'm going to slowly lower the leg. A little bit more, Chris. And there we have it. While this is a useful technique to use in the hospital setting, it is important to remember that most patients do not have an electric bed at home. So it is important to encourage getting out from a flat surface and practicing as earliest as possible.
Okay. So we have, I hope like all these videos would have given you good idea about the transfer. Okay, so during our tutorial class, we will see how to answer the question in OSCE and as well as in theory. Okay. So now we are completing the next topic also. And side by side, I'm just uploading the videos in LMS. So by today, I will be uploading all the slides of this one in LMS. Okay. Okay, thank you. If you have any doubts, then you can WhatsApp me or like we can discuss in next class. Okay, thank you.
Thank you.
Thank you.